right, if folks could grab a seat, we'll get started. Good evening. Good evening. How's everybody doing? Thank you. Wonderful. I'm going to stand up here. Makes me feel a little bit better. Welcome to Matter. My name is Arun Bhatia, program director here. First time to Matter. How many folks are first time? You know, this is really cool because I ask this question every single time and there's fewer and fewer hands. So that's wonderful that most of you have been here. So I'll spare you the spiel that we have, but I'll do a little bit of a commercial and an intro. So thank you all for being here tonight. Welcome to Matter. As many of you know, we love to do these types of programs where we have an opportunity to hear from some outside experts and some key opinion leaders from outside our ecosystem. One of the things that we obviously focus on at Matter quite a bit is looking at the collaborations between entrepreneurs and industry partners. And I hope that's one thing that differentiates us quite a bit. And we've had a lot of discussions over the last year and a half, especially with our health system partners. And one of the topics that has continually come up and that has been more prominent lately has been this issue of patient experience, customer experience in the healthcare world, which is something that maybe we don't pay enough attention to, but is getting a lot of attention now. And so one of the things we wanted to do was bring in folks who are working in that space, who know that space, who have some key insights and experiences in that space, and have them come and share their insights with us. And I always tell folks, you may not agree, you may disagree with some of their perspectives, but as any good entrepreneur, as any good innovator knows, you've got to listen, you've got to take in all inputs and make decisions for yourself. So we are really honored and thrilled to have Dr. Amy Compton-Phillips here from Providence St. Joseph in Seattle. And so she's going to share with us a little bit about, for sure, her background and what she's been doing and what they've been doing at St. Joseph's. Providence. She's going to speak for about 20-30 minutes, and then we're going to have Dave Johnson from Foresight Health moderate a Q&A. We're going to try something a little bit different tonight. So many of you know we have social QA. So matter.socialqa.com for those on live stream. For those here, feel free to submit your questions. We're also going to try having some live questions. So as folks have questions, feel free to raise your hand after the presentation. My ask is that you keep your question concise. Part of the reason we actually went to social QA was we had a lot of folks that wanted to give lectures, and I understand that. But we want to get as many questions as we can and give an opportunity for Amy to share as many insights as she can with us. So we'll take a few questions from the audience. We'll take questions from social QA, and I think it should be a fun conversation. Sound good? Excellent. Great energy. Awesome. Thank you. He's very excited. He's very excited. Awesome. With that, Amy, thank you for being here and welcome.
Thank you so much. I'm actually delighted at being here today. You know, usually I work with like a bunch of stodgy old doctors and nurses, and came here for a meeting a little bit while ago. And all I can say is I'm more energized now than when I came in. You guys have no idea of the like incredibly fun, vibrant ecosystem you have here. Or maybe you do know about it, but it's it's a secret for people like me. So I'm thrilled to be able to come here and talk. And what I'm going to be talking about is really about platforming healthcare and the way we're thinking about platforming healthcare and about how we might be changing the healthcare ecosystem as we move forward. And it's always a little bit scary to come in and be a talking head with prognosticating on what we think the future might hold and how we're going to be I don't know if you guys watch any political TV, but there's a lot of pundits on there saying a lot of things. And if you go back and look at the accuracy of the predictions of those pundits, it's not particularly high. I do think they might be better than Nostradamus, but not by much. But there is a book by a guy named Tetlock out of Berkeley, out of Cal, that's called SuperForecasting, and it's one of my favorite books. And SuperForecasters, they did something called the Good Judgment Project. It was something that the government put on because the government wanted to see how good were their analytical predictions. If they're saying that there's weapons of mass destructions in Iraq, they make big decisions based on that prediction, and they want to understand how accurate those predictions are. And so, in this project, they actually did a lot of predicting and figuring out what good predictors do. And good predictors do a few things. One is they're very numerate. They pay attention to the data, and they look backward and then make assumptions based on data looking forward. And they also, what they called something, they are intensely curious, and they are dragonfly-eyed. And dragonfly-eyed means they don't just look at the problem, but they look at the surrounding world and then figure out how the surrounding world and the history of that problem come together to make it more likely to have the future. And so I tried to do the kind of super predictor model to talk about what we're kind of thinking where healthcare is going. And the reason that's really important is kind of like whether or not you go to war in Iraq based on the assumption that there's weapons of mass destruction there. In healthcare, you make big bets. You put money down to build a hospital. A decade from now, we have to start planning now. So you actually have to predict where you're going to have demand and where you're going to have need to build the system of care that you need a decade from now. And so we have to be better than your average talking head at predicting because we need to make these kinds of strategic bets. So this is kind of my look at my dragonfly eye view of the ecosystem and see what we can predict. Everybody in this room absolutely knows Moore's Law. And that Gordon Moore defined it back in the late 60s. He said that every 18 months, computing power doubles and price halves. And it's held true for 40 years that it's been true. But the really interesting thing about Moore's Law is that the doubling occurred for 4 decades. And then somehow that doubling all of a sudden came to fruition in 2007, 2006, 2007 to cause an explosion of technology that changed our lives. And some of you were probably, I don't know, like 3 in 2007, but I actually remember the year. And one of the things I remember most about the year is my husband was trying to offset some gains and losses and sold Apple stock on December 30th of 2006. And then they announced the iPhone on January 3rd of 2007. So he quick bought it back again, which was good, but yeah, timing was not good. But so the iPhone came out, right? The iPhone came out. In fall of 2006, Facebook went from being a Harvard local network to being open to the entire planet. 2 guys in San Francisco realized they had a spare bedroom and a blow-up mattress, and that there were people who needed space, and they actually launched Airbnb based on that, and that was in early 2007. Hadoop became available, so all of a sudden the world of massive parallel processing and the concept of big data came to life. Kindle, so Jeff Bezos decided that he wanted to actually to disrupt the book publishing industry and really remove all the friction between authors and readers, and so they started putting everything online with the Kindle. GitHub, all of a sudden it became much easier, rather than having to code from the beginning in every single element over and over again, that you could actually do code sharing with GitHub, and changed politics as we know it. Twitter, YouTube, Google bought YouTube and launched it, made it grow, and then Android phones came out not too far after iPhones. I mean, all of a sudden, so 40 years, computing power advanced, and then things became possible. And so the change, the ability, the ecosystem that allowed for the change had to reach a certain point to allow for the flowering that happened, right? So that's part of the environment that we live in today. But there's another element that's very, applies really pretty much only to healthcare, and that's genomic testing. And so instead of Moore's law, we have the Carlson curve in genomic testing. And this is a logarithmic scale, if you'll see on the side, that the cost and ability to access genomic testing is improving faster than Moore's law, significantly faster than Moore's law. Moore's law would be that red line. And you see what the actual cost and ability to get genomic testing is doing. And so on top of this incredible data-rich ecosystem, you can also add in personalized medicine and genomics. Okay, so that's something that is, in our dragonfly eye view of the ecosystem we live in. I think that's an important data point to kind of file away. Another important data point to file away is that we've started understanding that we need to solve the problems that we're paid to do. And many of you might have read all of Clayton Christensen's books on innovation. But the story that really resonates me is the story about the job to be done in the milkshake. And just so you know it, in case there's one or two people in the audience that haven't heard it, I'm just going to tell it anyway, is that when McDonald's wanted to up their milkshake sales, it's hard to say, milkshake sales, they started tweaking the taste and having focus groups come in and tell them whether or not the taste was right, and it needed more chocolate, and it needed to be creamier, and it needed to be colder, and I don't know what they do to tweak the taste of a milkshake, but something to tweak the taste. And it didn't affect sales at all. And so they called in Christensen's consulting group and said, help us understand why, we've perfected our product, why have we not increased our sales? And so they went out to McDonald's and saw what people were doing with milkshakes. And they did a bit of ethnography and were following around the customers, and they found that half the milkshakes were being sold before 8:30 in the morning. And when they went up to the customers and said, what'd you hire that milkshake to do? First of all, the people thought they were crazy. But then after they said, well, okay, but really, what would you do if you didn't hire the milkshake to do that job this morning? What would you have gotten instead? And so people said, oh, well, banana, I'd have a bagel. They said, well, what made you choose the milkshake over the banana? Well, if I have the milkshake, I actually stay full till lunch, and I'm not hungry again by 9 a.m. And they said, and why didn't you choose the bagel? Well, because I actually drink this in my car on the way to work. It helps me on my commute. My commute's a long distance. It kind of keeps me company. It lasts for half an hour. With a bagel, I have to drive with my knees and put the cream cheese on it, and it's just not so safe. And they're like, okay, so it's convenient. It takes a long time to drink. It's satisfying. It's filling. So that's the job that our milkshake does. It's not all about the taste. The taste is probably necessary, but it's insufficient. And so then they figured out that, you don't put the big straws with it. You want it to last longer on the ride. You make it thicker so it takes longer to, you make sure it has enough fat in it to stick around so that it's satisfying. And by the way, the other thing that did is they said, turns out that the competition for that milkshake isn't just Burger King and Wendy's. The competition for the milkshake is also bagels and bananas. The market is much larger than just the fast food milkshake market. It's the breakfast market. right? And so understanding the job to be done really helps focus on the issue that you're solving for. And so if you take a step back in healthcare, think about the job that we're hired to do. And in the article that Dave and I wrote together about platforming healthcare, we said, there's the keep me healthy and then fix me, right? But there's a little bit more, so we do want to keep people well and we want to diagnose and treat the sick. People also expect us to make sure we know more next year than we did this year. So there's something that's really important in making sure that we're always on the cutting edge and we're always figuring out the next thing. So that's really important. People hire us to do that. They want to make sure they have the right people on board so that when we come in, do we have the right doctors and the nurses so that we can get the care that they need, that they can be comfortable in our hands, right? And then the last but not least, most people think that there's some social beneficence element to healthcare, that we should be contributing to our communities and making sure that they're the right place to live. And that's just kind of an expectation of us that may or may not be part of every business, but it is definitely a piece of ours. Well, it turns out that's not always what we do, because it turns out we own and manage a really complex real estate portfolio, right? We spend a whole lot of time and a whole lot of money. And in fact, in our company, we have this giant sucking sound with acute care hospitals that bring in virtually every dime of capital that we can come up with. Our hospitals would take it all up, given the opportunity, because that's where the bricks and mortar cost a lot of money. We also build and manage incredibly complex IT systems. So the EMR is one piece of it, but then there's the PACS unit, and then there's the costing unit, and then there's the billing, and then there's the security system, and then there's the email system for inter-company communications. We have to be able to earn a living, so we bill and play. So we have this entire vertical integration of this incredibly complex web of things that aren't the things that people pay us to do. And the insight for me, our CFO recently joined us from Microsoft. And I was talking with him about, this vertical integration, I'm not so sure about it. Did you guys do anything interesting at Microsoft about making sure that you had the right people doing the right work at the company? And he's like, yeah, about 15 years ago, we outsourced our IT. I'm like, what? Come again? Yeah, Microsoft outsources their IT. They consider it a commodity, that running an IT backbone for a company is a commodity business, that they want to spend their energy focusing on their differentiating factors, which are really the knowledge generation and the services businesses and Windows 365 and cloud computing, and just running the IT back end, an ERP program and a email system and your billing and collections. Outsource that. So I think it's actually just really interesting when you start thinking about the possibilities of changing of what we should be doing and what we actually do. And then the last little piece of the ecosystem, as we look at with our dragonfly eyes, is kind of who the players are in healthcare and where the dollar flows go. One of my husband's favorite lines is follow the money. You follow the money, you figure out the infrastructure, right? And in healthcare right now, who owns most of the risk? Well, that's insurance. They really get the brokerage fees, aggregating risk across a population and then hoping to make a margin because the actuaries predicted well enough what the costs were going to be and distinguish that. And so they take some money off the top of that, but they really carry the risk in the system. Profits right now and the way it's set up in the U.S., we just had an interesting conversation about the profits in the U.S. because the U.S. kind of basically funds most of the profits in the R&D for the rest of the world because of the negotiating capacity that other systems of care have compared to what we have in the U.S. So we really pay in the U.S. for the profits mostly for the pharma and device manufacturers, and that's where the biggest chunk of profits is in the industry at the moment. And then what do the healthcare delivery systems own? Well, we own the debt. I know how much debt we have. It's a lot of debt because it turns out that those big mecca buildings that we build cost a lot of money. We had on average a hospital bed in California with all the seismic regulations that we have costs on average $2 million per hospital bed to build. It's a lot of money. You gotta have a lot of capital to fund $2 million a hospital bed. So we own the debt. And so if I put that all together, I say, I wonder if the way we are today, knowing the way data, information, genomics will be changing our system, knowing that people pay us to do one thing and we do a whole lot of other things, knowing that that other people are making money in healthcare, and meanwhile here we are trying to struggle to cover everybody that comes to us, because turns out that in our system alone, 66% of our patients are paid for by the government, either Medicare or Medicaid, and we lose money on all those patients. And it's really hard to make a profit or make a margin as a not-for-profit system like we are, make a margin when you lose money on 2/3 of your customers, right? So we've got to figure out a way to put all that together, because we believe that healthcare is a human right, that it needs to be available for everybody, and that we have to make it affordable for all of our communities. And to do that, we need to change the system from where it is today. And just to open up our thinking, you guys, I bet everybody in this room at some point in their life has stayed at a Marriott or eaten at a Marriott or walked by a Marriott or done something, because Marriott's kind of ubiquitous, right? Marriott wasn't always ubiquitous, but they decided back in the 70s that their business that they were in was actually hospitality, that their business wasn't necessarily owning hotels, and in fact they divested themselves of their hotels, and now they are a franchise model, but they're incredibly successful, and I think they manage now 6,000 hotels, and meanwhile they also have the Marriott Host Services, and it's one of the most profitable companies in the hospitality industry, and they don't own a single property. And so as you start thinking about what that's like, that's what Amazon does, right? They do own a few warehouses, but they manage the flow. They manage an incredible amount of supply chain in virtually any industry, but without owning the supplies and without owning the distributors. Airbnb is a platform company that manages to connect people who have the need for a room with the people who have a room, right? And it's that kind of thinking about how do we get better, rather at owning all the hard assets, rather than being the ones who build complex IT systems, rather than being the ones who are vertically up and down this entire chain. How do we start freeing up capital to invest and build the healthcare system that we need for the future? And so the way we've been doing that, this is incredibly complicated, and for those of you that are any medical background in the room, we call this our Petri dish slide, which, so the little colonies that we've got here are, but it's kind of our strategy on a page, and what we're working hard to do is to rapidly move towards Health 2.0. That we think the way we are today is we live in a Health 1.0 world, working hard on getting to the Health 1.5. In the Health 1.0 world, hospitals have been in the past the nexus of care for communities, for societies, for the way we're put together, that we have this building where people come to the building and they get most of their care. Even doctors who have offices outside the building have admitting privileges to the building, and it's been kind of where most of the services are accessed, where we have the imaging systems and where we have the labs that get run and where we have the pharmacies that do the complex procedures, right? And so that's when you're sick and in need, people come to us in Health 1.0. Where the country is working hard and pushing, and we're getting value-based care payments and bundled payments to work really hard to get to Health 1.5, which is all about moving care into our communities, requiring less at the hospital, and instead focusing on value, getting care closer to home where people live, work, and play. And we're able to put some things in that area that are definitely changing up the come to us. And so that's really moving care, helping people stay well, I would put in that Health 1.5 world. But it is still in a community. What we're hoping to do is actually move to a Health 2.0 world where it's digitally enabled, seamlessly connected, and available anywhere. And in order to do that, it has to be decoupled from, but it has to be enabled anywhere. To do that requires seamless data connections, the ability to have platforms that allow us to access information anywhere. It really does center around patients and the way they live their lives, because it turns out if you're on vacation, Dave was just telling me he just got back from France, but if he had a problem in France, how could he just go online and connect with me virtually via telehealth, or be online, get access to his EMR, his medical record, have what he needs, and how could we make sure that connection is able and happens in a way that decouples us from geography. And so now we're working on doing the things that it's going to take for us to get to this Health 2.0 world, to say, how do we build an ambulatory environment? How do we build a data ecosystem? How do we build a system of services and care that allow for us to be the power inside of whatever it takes, whether it's putting our express care platform anywhere in the country for anybody that wants to use it, whether it's putting our analytics at use in the cloud for other people to have access to. We really need to start changing our investment, moving away from the giant sucking sound in our hospitals, to putting that into these other tools and abilities to enable this digital seamless platform that surrounds where we are today. So that's what we're actively working on doing. We're actively managing our investment strategy. We're actively managing our partnerships. We're thinking about building what we have to and partnering for the rest, because we just don't think that we should be in the business of doing all the vertical integration, because we are not a real estate company, and we're not an IT company, and we're not a lot of things. We are a health and a healthcare company. And our vision, our mission, our goal that we're trying to do is really trying to transform health and healthcare for all that we serve. And we think that for us to actually be able to have us really have that vision kind of painted out in the crystal ball is to do what. And as I looked up this quote, I don't know, like 73 people have been named as the one who said it. Everybody from Abraham Lincoln to Steve Jobs. So I didn't put who said it, because just assume that everybody said it at some point in their life. But we really think that the best way to predict the future is to create it. And so that's what we're working on doing, because in the end, we really want to have health for a better world. So thank you. That is my. Where are we going? So Dave, I think you're supposed to come up and ask me questions.
Yeah, they were going to get us
very
commodious seating here.
Oh, good. They knew that I was going to wear heels. And even more important.
This is a fireside chat without a fire.
Oh, yeah. I have a drink. So excited.
That looks good.
Yeah, sorry I didn't get you one.
Well, you already made me hungry with the milkshake story, so. Well, good. Well, first of all, let's give Amy another round of applause. Arun didn't mention, but I have this very exalted title at Matter. I'm the author in residence, or Matter Air author in residence. And I just think it's such a great opportunity for the Matter community to bring somebody like Amy in, who understands the world we're in, but has a vision about where we can go. And we did write this article together. It's got a great title. It's called Platforming Healthcare, Owning Hospitals is So 2015. And what we're going to do, and it's to encourage feedback, because Matter lives on feedback, we all do. We're going to include a link in the survey that goes out afterward to the article. So fill out the survey, get Platforming Healthcare, So 2015. So I'm going to ask a few questions, and we're going to get a little outside our comfort zone. We're going to actually, at some point, let people stand up and ask questions. Kind of an old school approach to things, as well as going off social Q&A. But anyway, Amy, before we get into the audience participation part, it feels like from everything you're saying, and that your organization and the system as a whole is under enormous pressure to change. Where is that pressure coming from?
You know, thank heavens, finally, we have some pressure to change, because all we've done since I entered medical practice, well, I got my MD in 1990, so it's been 28 years, and since that time, healthcare costs have gone up 3x, and our position in the relative position in terms of health outcomes for the people who live in the US have increased, but not even close to the rate of increase of other countries, so that we're now at the bottom of the barrel of the rich industrialized countries, even though we're double the cost. And so there's been something askew in the way we are funding and rewarding healthcare in the US. And finally, people have kind of looked up and said, is this what we want, and is this what we're paying for? No, it's not. Why are we paying so much money and getting such relatively poor outcomes? It's not poor outcomes, and I can say a bit to that in a minute. So finally, people are saying, you know, we need to figure out a different way to pay for this. And by the way, it's too much money. That now, you know, 18 to 19% of the gross national product is more than we want to be paying. And so we're going to start tightening the screws and turning off the spigot. Before, what happened, and what's been happening for the past almost 30 years, is anytime we thought we needed more money, we just added more stuff. And we made healthcare incredibly complicated because we kept adding, and never leaned, never removed. And so now, with people saying this is too much money, and the turning of the spigot and the drying up of the money flow, people are having to go, oh, maybe I actually need to lean and iterate and innovate to figure out how to do things better. So I actually think being tight in dollars is a stimulus for innovation, that otherwise you get flabby as an industry, and it's time for us to actually address the flab and go on the self-help program and figure out how to get rid of it.
So part of the pressure is just the government and corporations and individuals paying for healthcare just can't believe how expensive it is. And how much do you think might also be a function of some of the people in this room, that there are new business models that are starting to emerge that are challenging the incumbent business models in the same way Amazon or Walmart challenged mom and pop grocery stores, and now Amazon is challenging Walmart?
I cannot tell you how many healthcare meetings I go to where there's a picture of Blockbuster up on the screen. And you know, people lead with this fear to say, we, the fat cat happy incumbents in healthcare, if we don't figure out what the right business model is for the future, are going to go the way of Blockbuster, are going to go the way of, which one closed, Borders or Barnes & Noble?
Borders.
Borders. We're going to go the way of Borders. Because
Barnes & Noble's a coffee shop now, I think.
Oh, yeah. It still exists, so it's better than Borders. You know, right? So you know, we constantly talk about that and realize that we as a bloated industry that costs too much, that's not meeting the demands on a regular basis of the people that we serve, that we are at risk for disruption. And we know that, and if we are not paying attention to that, we are at real risk for going down.
Yeah.
And the reason why I say almost, so I'm going to use words like, you know, we're too expensive and we don't have the right health outcomes. Another thing that I just do want to point out is that lifespan has increased by 10 years since I've been in practice. Death rate from cancer has gone down from 230 out of 100,000 down to 160 out of 100,000. Healthcare has gotten better. Healthcare is improving, right? Outcomes are improving. It's just not improving as fast as the rest of the world is. So
good, terrific.
So
you know,
I apologize for my shortcut.
My favorite story about Blockbuster is they had a chance to buy Netflix and decided that was a bad idea.
Yeah,
So there you go. Well, let's dig into platforming a little bit. There are a lot of questions about platforming in here, and it's kind of funny how Amy and I ended up writing this article. We sit on this board together for a company in Seattle, and there was a break in the action, and she leans over to me, and we'd been talking about something in the presentation. He goes, "Don't you think this is all going to just become a platform someday?" And I said, and I read back, I said, "Well, that's exactly what I think." And said, "Well, why don't we write about it?" So we did. So let's. But I do think the word platform has many different definitions to many people. I know the way I initially thought of it was that all companies have inputs, all companies have outputs, and then in the middle you've got this big box, which is the company, and you decide what you're going to own, where you're going to partner, and where you're going to outsource. And the mix of those things really depends on how do you drive the best outcome at the lowest cost. And healthcare, for a lot of reasons, really optimized performance, revenues, profits at the health system level by owning and controlling everything in the middle. And as you're so eloquently saying, that doesn't work for the world we're going into. So, Amy, could you give us your definition of platform, how you look at it, and how you're seeing it change inside of one of the larger, more complex health systems in the country?
Yeah, so you guys can tell me how wrong I am, because I'm just a doctor. I don't like do this whole tech stuff. But the way I think of a platform is a foundational piece that allows a company to connect seamlessly, where you don't have to own it, build it, buy it every time you have another use case for it. And so my conceptual vision that I use for my prototypical platform, and it might be kind of a big prototypical platform, is Amazon. That Amazon is, you can be a third-party seller, and they have the infrastructure that allows you, so it serves as the broker between the customer and the buyer, right? And you can use that infrastructure. You don't have to build it every time. You don't have to recreate it from scratch each time, and instead it becomes the component that you can build for many different purposes. And that's kind of what I think in healthcare we need to do, is we need to have an IS platform, an IT platform. We need to have a billing platform. We need to have a healthcare information.
That's very nice.
Yeah. It's to soothe the savage beast. I must be like bothering somebody's nerves or something. But so that's kind of what I think as a platform is. It's a tool that's able to be used repeatedly in different use cases that fits into the whole. And I don't know, you probably have a better definition.
No, that's a pretty good definition.
Okay.
But you did mention Amazon, and the CEO of Amazon's Jeff Bezos, and there's the old story. There are two kinds of strategists. There's the fox that does a lot of things well, and then there's the hedgehog that does something really, really, really well. And I sort of put Jeff Bezos in that hedgehog category, which is his one idea is, I don't care what it takes, I don't care who it hurts, we're going to drive value to customers. And one of the things they're doing right now is they are losing a fortune on the last mile on the delivery side. You can order a $2.50 set of straws, and if you're on Prime, they will pack that up in a box and deliver it to your house, and God knows what that costs. But they're probably losing 2 or 3 times what you bought those straws for. So they're losing a fortune, but money is cheap for them. And it's almost like the Soviet Union and the U.S. competing in arms control. They're just going to do it cheaper until they, make Walmart cry uncle and everybody else. So this relentless focus on the customer. And you told the story earlier that in every meeting at Amazon, there's an empty chair to represent the voice of the customer. Healthcare is a really strange industry. It's really the only one I can think of, except maybe higher ed, but anyway, let's stick with healthcare, where principals execute transactions without customers. You go to the doctor tells you what to do, you do it, somebody else pays for it. So it severs that, that connection between the buyer and the seller. The information exchange doesn't happen. The market signals don't occur. And in your version 2.0, it wasn't only patients, but it was customers at the center of it. So how do you take this industry that really doesn't have the muscle memory or the instincts, and Amazon lives it every single day. How do you start to inculcate that customer-focused vision inside a system?
Yeah, it's such a great question, and part of it is leadership. It's not going to happen natively because of the dysfunctional economics and business models that exist in medicine today. That it has to be a conscious decision, and that we have to understand that our ultimate customer. It doesn't matter if really the employer's paying the bills or the insurance company's paying the bills. The customer is the patient and their family and that community that you're serving, right? And so that's one thing that we hold dear. That we believe that is the people that we are serving, and that's our job is to have them be number one. So I would say leadership. The other thing that we will get to, and we're not there yet, so full disclosure, but we are working towards getting there in a way that doesn't disenfranchise our people and our doctors and our nurses, is transparency. You know, I love the concept that transparency is, sunshine is the best disinfectant. And what ails our industry, because there's just a lot broken in it. As much as I love the industry and I love the profession and I love the concept, that it's so opaque that information asymmetry makes it so that patients don't understand their options, they don't understand what's right, doctors don't understand the costs, nurses don't understand what they can do to add, and so having transparency, I think, is really critical, and transparency about the things that matter, right? So if you're going to go buy a dress, you don't particularly care what brand of thread it is, or maybe you care what the content of the material and where it was made, and if you're socially minded, maybe you care if it was fair trade. What you probably really care, though, is do you like it and what's the fit, right? And is it at a price point? So can we have at least that relevant information available so people can make important decisions relevant for them? And so I think we're working on getting there. At the moment, because we haven't built the infrastructure to allow that to happen, we're not ready to open the kimono completely and expose all that information without letting our clinicians see it first and address it, and then we can open it.
Yeah, the transparency is.
Yeah.
Yeah, sunlight is the best disinfectant. You know, I got to tell you, the last time I bought a dress, all I cared about was how I looked in it. So
you would fit into Seattle. It's a good area.
Yeah, that's good. I loved your Marriott example and of a company that really just runs on brand and customer service, and doesn't own what it doesn't need to own. Differentiates in the marketplace by connecting directly with customers. Oh, that was interesting. I need to lean down more often or go like this.
Yeah.
So I excuse me. I love the phrase brand heavy and asset light. And one of the questions on here is, do you think over the next 5 to 7, 10 years, Prov St. Joe will really start to divest significantly of assets in a way a Marriott did, and if so, kind of how will that happen?
Yeah, we are actively going through a process of saying, what do we need to own? What do we need to partner with? What should we divest in and think of as a commodity that we can purchase on the market? Because we're a $23 billion company that we take in $23 billion in revenue each year, and we spend $23 billion of revenue each year. And we're not 100% positive that we're spending that $23 billion each year to generate the best health outcomes. And so we're actively looking at how are we spending that $23 billion, and is it the right way? And what our near-term aim is to spend $1 billion less in our infrastructure pieces that we're doing today so that we have $1 billion more to spend in building these assets for the future. It's just in round numbers, because we just don't think that we're spending the dollars. You know, we could really perfect and absolutely get the cutting edge healthcare system of the 90s if we continue what we have going today. And that's not really what we're shooting for.
Yeah, Back to the Future.
Yeah.
There you go. Well, that's kind of a good point maybe for this next question, because I weigh all the time, are we looking at evolution or revolution in sort of where we go ultimately in healthcare? And is it really something we can get to incrementally, or is there going to be some kind of Amazon-like company that drops from the sky and that we don't even know where they are? They're probably in this room right now, you know, preparing for the collective demise of all the incumbents. But as you sit here today, do you think it's evolution or revolution or some combination of both?
I think there's an eye of the beholder question in that. If I am a video watcher, I think that it was evolution to go from Blockbuster, you know, from what I had growing up, which you watch Sound of Music and Rudolph the Red-Nosed Reindeer once a year when it comes on, and everybody, you know, the world stops so you can watch it on the one time it comes on TV. And then we had what felt to me like a revolution to get Blockbuster, and you could watch Rudolph on demand as often as you wanted to. Just ask my children, because when they were young, we did that.
July 4th.
July 4th, Christmas in July, The Grinch and Rudolph. So that felt to me like a revolution, and then Netflix came in, and it felt to me like an evolution. Right, because the big thing for me was being able to watch what I wanted whenever I wanted to. If you were at Netflix, it probably felt like a revolution to get rid of Blockbuster. So I don't know. I think the world's going to change. You can pick the R, no R, I don't know, you know, whatever you want, but I think the world is going to change, and it's going to look a lot different a decade from now than it does today.
Yeah, and the pace of change. There's Edward Teller's son, the guy that developed the hydrogen bomb. His grandson's name is Astro Teller. And
like the dog in the Jetsons?
Yeah, exactly.
Okay, just checking.
And the analogy gets even better because his job at Google is he's in charge of moonshots or something like that. And he
into the role.
Yeah, he puts up this chart that says this is sort of the capacity of human beings to learn. So this very narrow slope, and then this is the pace of change. And he says, for the first time in human history, the pace of change is happening faster than the ability of human beings to adapt to change. And sort of the only sort of short-term way to get around that is lifelong education, curiosity, and so on. As you're sitting there, you know, $23 billion company, and I think that Astro's onto something there with this. And a lot of the pressure I think we feel just being professionals is one of just trying to keep up. And we work in a vital industry. So how do you think about this pace of change versus ability to adapt, and particularly from a large organizational perspective, because then culture, is everything. So.
Thomas Friedman has that same graph in his book, and it's just a great illustration at why people feel kind of out of control at the moment. That, you know, if learning is this way, and if it's a exponential curve, the pace of change, that it's easy to see that maybe if we haven't crossed over yet, we're gonna soon, and it's gonna keep going up. And so how do we adapt to that? I think we stay open, we continue learning, and we become incredibly nimble because we have to. And we figure out how to create mobile, scalable, plug-and-play adaptable systems that the age of the mainframe is come and gone. And so instead, how do we create the ecosystem? And by the way, it's the ecosystem we want to create. You know, something that we were having a conversation earlier today something I worry about and lose sleep about, but I think we can solve for. I think there's a solution there. Around a third of the care we provide is in rural areas. And in rural areas, hospitals often are 30 to 40% of a small town's economy. And so if we're moving to an era where healthcare is much more virtual, kind of my little construct I have in my mind, this is in that fortune-telling realm, is a decade from now, I see rural hospitals as being ERs, ICUs, and maybe an occasional urgent surgery, and the rest of it is maternal, probably childbirth units, and then everything else is going somewhere else. There's
Travel agency.
travel agency, I mean, literally, we're talking with our Focus Factory joint replacement hospital. It's like, what would it be like to put an OR on a flatbed truck and truck it around? And you have like the mobile mammo van, you have the mobile joint van, and be able to do joints close to home. Like, how could we start delivering care for rural communities in a way that doesn't decimate that population? And we really need to be thinking about that as almost 20% of the American economy, we have to be thoughtful about the investment decisions that we make so that we don't devastate the hope and future of our country. And so we're trying really hard to make sure we deliver care close to home. We enable really smart people to work wherever they live and live, work, and play. We enable robust, productive careers, and we continue this unbelievable gift of a profession that we're allowed to work in, where people trust us with their lives, and we need to be able to allow people to do those jobs.
Yeah.
So.
I'm just going to take a moment. That was pretty powerful. So let's shift to a problem of epic proportions. The first rule of performance improvement is you're supposed to fix a problem before automating it. And what we ended up doing in healthcare was automating a fragmented system that was more billing focused than clinical outcomes focused. And the result has been we do now have longitudinal data, and that's probably good. But the pressure on clinicians, you see these studies that clinicians are spending 2 to 3 hours on administration for every hour with patient, and burnout is at record levels. We are where we are, but how do we go from where we are today, in a sense, with all of the capabilities that are now? I mean, that 2007. That's pretty amazing at everything that came together. And who knew we were worrying about the housing crisis? But how do we take where we are now and get technology to a point where it does what you're just suggesting, where it makes life easier. It pushes real-time information to frontline caregivers. It reduces the administrative burden so that frontline caregivers can spend more time with patients, do what they want to do. What are your thoughts on that?
Yeah, option, if I were queen of the world and I got to wave my magic wand, option A would be blow up all problems of epic proportions. March on Madison, and start fresh, right? And that is hope is not a plan. That's probably not going to be the effective way through. And so I think we need to design ways to make it work. So unless, and the reason why I'm not saying we just need to completely rebuild Epic, Cerner, Meditech, name your dastardly EMR of choice, is that if Google failed at it and Apple failed at it and Microsoft failed at it, I don't feel like the issue is a technical issue, because they have some pretty amazing technical savants in those organizations. I think the issue is a healthcare system issue, and that we need to be solving the healthcare system problems. That why do we have to code every iota of everything to be able to document of why we get paid? Yeah, I mean, there's some really things that's important to do. And instead, I'd love to solve for the issues that we really want to care about, like, well, actually, as a author in residence, you'll care about this. Something that I care about a lot. Yeah, right. I'm a primary care doctor. And a big important piece of primary care is knowing the story of the people that you are working with, right? And you need narrative. And one of just the really terrible things that our EMRs do, because they were architected in an era where you could only get data out if you put discrete elements of data in, is they destroyed narrative story. They destroyed the story. And instead, you had to answer drop-down lists and yes/no questions, and you don't get the story. And that's why people would feel like a number if you're trying to complete a bunch of drop-down boxes. And so what I'd love to see is making sure that we can apply natural language processing and automated tools to pull discrete elements out of narrative. And if we can bring narrative back into healthcare, we go a long way to solving the disaster that healthcare, that our EMRs are. And so if it's not start over and rebuild it from the ground up, which is the tough thing to do, let's at least start fixing the bad parts of the system that exists today.
Very good, yeah. Look at that, spontaneous. This power of narrative really is much stronger than I think most people give it credit for. I was interviewing the president of a company called Absolute Care, which deals with very complex, chronically sick people. The CEO calls them train wrecks, not terribly politically correct, but he described one of their patients as the sickest patient in the state of Maryland. Multiple comorbidities, double-digit visits to the emergency room. Literally, he was the most expensive patient the previous year in state of Maryland. He was a Medicare Advantage patient under an Aetna contract, so Aetna assigned this guy to Absolute Care, and they do what places like Oak Street and others do. They had a huddle, and everybody came together and talked about this guy. And it turned out the single most important person in the huddle was the van driver, who spoke up and said, I don't know, but this guy likes to go to church, and he's in a good mood when he gets there, and he's in a better mood when he gets back. And so someone said, well, he's clearly social, and he's isolated a lot. Maybe we should make him a greeter in our center. That way we'd know he'd get his meds and, the social thing. Well, that was the magic bullet. Over the course of the first couple of months, the ER visits, cut down by 2/3, and within 6 months, no ER. Basically, they took the single most expensive patient in the state of Maryland and looked at the whole picture and invited a van driver to contribute to the solution, and he became kind of a relatively moderate cost chronic care patient who was leading a much better life. And,
well, that's it. Yeah. When you know someone's story, as a, you can be a doctor, you can be a nurse, or you can be a healer. Every society on the planet has had healers, and I'm a scientist. I mean, this is going to sound like a less than science thing, but it's true. Is that if you try to distill a human being to a series of check boxes, you don't know the person. You know the check boxes, and so you don't know that they're missing on the spiritual or the social or the economic. All you know is the physical. And people are way more than the sum total of the physical checklist. We need to actually understand mind, body, spirit to understand health. And that is the frightening part that we distill away when we try to make us all ones and zeros in a set of numbers.
Yeah, I mean, it's when people think they're going to get better, often they do.
Right.
And quite honestly, when you read people a list of side effects, which in my definition are really effects, it's amazing how many people develop the side effects when they, oh, that must be what's going on. And then, I read this remarkable interview with a physician, and very highly acknowledged physician, and they were asking him about his regrets. He was a cancer oncologist. And he said at one point in his career, he diagnosed somebody with terminal cancer and said they basically had 2 months to live. They should go home and get their affairs in order. And person did that and died 2 months later. They did an autopsy afterward, and there was no evidence of the cancer at all. And but what had happened was the mind had, influenced the body. So this connectivity, I think you're really onto something there. Well, I think, Arun, now would be a good time to kind of open it up to some brave souls. And here we go, right in the front row.
We have time just for a couple quick questions.
Okay.
For young and budding entrepreneurs who are coming outside of healthcare into working with hospitals, what are 3 books, authors, or papers that you heavily recommend to add context to the stories of healthcare so we can be better prepared for the conversations that we're going to have with our hospitals?
Let me start on that. Market versus Medicine by David Johnson. Yeah.
Good one. 2 left.
That was number 1 on my list. So what are some other of, and so I have to admit, I read a lot of books, and less of them are about healthcare.
Sci-fi books.
Yeah, really. But I do like Tom Friedman's Age of Accelerations that has that book. And then for entrepreneurs, John Doerr's book on Measure What Matters, I like a lot. A recent one that was done.
I'd throw a Clay Christensen book in there.
Oh, yeah. Oldie but goodie.
Yeah.
You don't mind reaching back.
Yeah.
And you too can cite the story of the milkshake and many.
And
sorry if that's too old.
And the
Everybody
jobs to
knows
be
it.
done. Okay. Here we go.
You've mentioned Amazon a few times during your talk tonight. I thought I'd share with you just a small story that broke this week was Amazon has hired a cardiologist from Mass General to come work for them, but they're not commenting on what he's going to do. What's your reaction when you hear companies like Amazon, Microsoft, et cetera, moving into an area where maybe they're going to start to develop solutions as opposed to just being a platform for other solutions?
Again, healthcare is almost $1 in $5 in the American economy. If we don't have full awareness of the fact that every company with money is going after this market, where we have blinders on, right? Apple, Google, Microsoft, Amazon, they are all in. They all have huge innovation groups. We're working with them. One of the things we are thinking about is while they are incredibly good at technology, we actually are incredibly good at patient care, and we have a lot of information that they don't have. And so we think that there's ways, in the same way there's ways to set up partnerships and other things, that why don't we use our forces for good and not evil and combine them, and we can cooperate where we should cooperate and we can compete where we should compete, but think about partnerships in a different way.
You know, another really interesting acquisition that got announced over the last week or so was Best Buy making its most expensive acquisition in history, buying an online kind of care management company. You know, I think what it's going to be is the Geek Squad coming to your house to deliver care. But Best Buy, I mean, who would ever expect Best Buy to go into healthcare? One more, huh?
I'm curious on your perspective that right now EMRs are such a predominant tool. So we think around platforms coming in for other people to build a better story. It's not really something that people are trying to take on. Everything should stay in the EMR. My team should use the EMR. So what's your thought about how platforms can work alongside the EMR to kind of engage your patients better?
Yeah. So I think I said it out loud, but now I'm getting the conversations all gamished together. So if I didn't, I meant to. That I see two customers in healthcare. Yeah.
You have those active conversations in your head too.
Yeah, that's why it's just like the little guy on my
The
shoulder.
many voices.
Yeah, many voices. I see two customers in healthcare. You know, there's the patient family customer, but there's also the workforce customer. And we have made it so incredibly hard to practice medicine or to practice nursing or to be a pharmacist because they're more focused on the clicks and the documentation than they are on the face-to-face work with a patient. And so in my mind, kind of a non-starter for me is if I make a clinician work outside their workflow, if I make it harder for them to hone their craft, it's not going to fly. It just can't do it. Can't ask our docs to do more. And in fact, I am actively seeking ways to make it easier to practice the clinical field of choice that our people work in. And so that's why it's like it has to simplify the workflow. It can't make it harder.
Good.
We're going to wrap up. We're a few minutes over, but I want to please give a round of applause to Amy and very much for being here. And as Dave mentioned, we'll be sending out a survey, and I'll send out that link to their article as well. So thanks, everybody.
Thanks, everyone.